Hey guys, welcome to another episode of Ash and Laurie. Today we're talking about a very important topic, which is bowel cancer screening, and we're going to show you how to do it.
No, hopefully not. Firstly, just quickly a bit about bowel cancer. Bowel cancer is any cancer that occurs from the rectum up until the large bowels. It's quite a common cancer, especially in Australia. It's the second most common in men after prostate, and second most common in women after breast cancer. Mostly we see bowel cancer in people age 50 and above, but unfortunately we do rarely see younger people affected, even in their 20s and 30s. Bowel cancer has a big impact in Australia because it is the third most common cause of cancer-related death. So preventing and trying to treat this bowel cancer early is very important, and that's where bowel screening comes in. The earlier we pick up cancers, especially for bowels, the better the outcome of survival. So we know that for stage 1, where it's very small and just confined to the bowel, 5-year survival is nearly 100%. When you progress into stage 2, 3 and 4, that survival drops, and when it's stage 4, where it's moved on to another organ from the bowel, the survival rate goes down to nearly only 10%. So again, that shows us the importance of early detection. So we know that screening in cancer is successful, it's worked. We've detected more over the years, but we are detecting it at an earlier stage of the cancer, and so these people in general are living longer with cancer.
So the bowel cancer screening program in Australia starts for people at the age of 50. So the idea behind screening tests is that it's for asymptomatic people, so people without any symptoms of the disease. So if you've got any symptoms of the bowel, such as bleeding from the bowel or a change in your bowel routine, it's probably better to see your doctor about what test is going to be the best for you. Screening tests are designed to pick up people at risk early. It doesn't necessarily give us a diagnosis of the disease itself. So the way the bowel cancer screening test works is with what we call a FOBT, which is a fecal occult blood test. Now that detects blood which is invisible to the naked eye, which might be released in the bowel from things like bowel cancers. There are lots of different things that can cause blood to end up in the stool. So things like hemorrhoids or little tears around the back passage, and things like polyps as well, which are little growths on the surface of the bowel too. So in the case that your test is positive, the next step is to organise a colonoscopy, which is a camera that's passed through the large bowel to have a look inside. That's a better test to detect bowel cancer. So in 2016, there were about 58,000 returned positive FOBTs. Now that might sound like a lot, but in actual fact it's only about 8% of all the total returned tests. 36,000 of those people went on to have colonoscopies, which then went on to detect about 1,400 cases of colon cancer. But we are picking up these cancers very early, which, as Laurie said, results in a much better treatment outcome and survival. So the test itself looks like a little bit like this. So this is the collection container. And yes, you do have to get a sample of your own poo. In fact, you have to get 2 samples on 2 separate bowel motions. But it is very quick and easy. So let's show you how it's done. Come with me.
Am I coming?
Okay, so here we are. Not sure if this is such a good idea, but sounded good in theory. So what you're going to need is your collection stick and container. And if you got your bowel cancer screening kit from the government, they'll actually give you a piece of paper to lie over the water of the toilet bowl. But if you got a kit from your GP or somewhere else, you might have to find something else to catch your sample. You could use an old ice cream container lid. What I've got here is a takeaway container lid. I think that'll do the same trick. Okay, but first thing you want to do is actually empty your bladder. your sheet of paper or your plastic lid. Just pop it in there. Oh my goodness, is that going to hold? It's not going to go down any more than that. Okay, so all set for a nice soft landing here. Okay, the plastic lid's in there. I'll just pop the camera down and so I can sit on the toilet. Okay, so I'm about halfway there, I think. I'm just not sure what I'm supposed to do about wiping. I guess you have to do that afterwards. Alright, so I've got my stick and container. Now you need to drag the stick in a zigzag fashion along the poo to collect the sample. Now don't forget to label your specimen with your name, your date of birth and date of collection. Okay, so that's it. I've collected my sample here. Just a couple of observations. It's weird standing up from the toilet having not wiped, and also the smell wasn't as bad as I thought it would be, given there's no water to insulate against the smell. Anyway, this was a very weird experience to share with you all. Better get back out to Laurie.
Oh, you're back.
Let us never speak of that again. So that's it about bowel cancer screening. It's a really important test to get done. At the moment, there's only about 40% of people who return the test. So for it to really be an effective test, there needs to be more or better uptake. So if you're above the age of 50, make sure you don't throw away your bowel cancer screening test. Yeah, please do it. It does help save lives and it is an effective screening tool. If you know someone who's above the age of 50, yeah, let them know about it or double check that they've done it. It's quick, easy and painless.
Get it done. Tell your parents. Everyone.
So that will about do us again for another day. Please give us a thumbs up if you like the video. Please subscribe. Follow us on Instagram.
Yep.
Yeah.
All right.
See ya.
See ya.
Bye.